नमस्कार students, खुश रहिए. This session is about anemia. Anemia is a major killer in India. Statistics reveal that every second Indian woman is anemic. One in every five maternal deaths is directly due to anemia. Anemia affects both adults and children of both sexes, although pregnant women and adolescent girls are also most susceptible and most affected by this disease. Anemia, split into two words, an means without and emia means blood. So there this is decrease in the rbc count or red blood cells count, hemoglobin and or hemocritic values, resulting in a lower ability of the blood to carry oxygen to the body tissues. Now the normal values for man, the normal values are less than 13 gram per dl. For women it is less than 12 gram per dl. For pregnant women it is less than 11 gram per dl. For infants from 2 to 6 months it is 9.5 grams per dl. Children from 6 months to 24 months 10.5 grams per dl. 2 years to 11 years children, it is 11.5 gram per dl, and children from 12 years of age, it is less than 12 grams per dl. Now, classification of anemia. Classification on the base of causes, it's due to blood loss or inadequate production of normal blood cells or excessive destruction of blood cells. On the basis of morphology, it may be normocritic, microcytic, or macrocytic. Types of anemias based on clinical picture: iron deficiency anemia, megaloblastic anemia, pernicious anemia, hemorrhagic anemia, hemolytic, in this thalassemia and sickle cell, and aspatic anemia. Iron deficiency anemia is due to excessive loss of iron, and women are at higher risk because their menstrual blood and growing fetus. Megaloblastic anemia due to less intake of vitamin B12 and folic acid. Along with that, red bone marrow production abnormal RBCs, that is red blood cells, due, due to cancer cells also. Pernicious anemia, inability of stomach to absorb vitamin B12 in small intestine. Hemorrhagic anemia is due to excessive loss of RBC through bleeding. Stomach ulcer, menstruation, or hemolytic anemia is due to RBC plasma membrane ruptures or may be due to parasitic toxins or antibodies. Thalassemia, less synthesis of hemoglobin found in population of Mediterranean Sea. Sickle cell anemia, this is due to hereditary blood disorder characterized by RBCs that assume an abnormal, rigid, or sickle shaped. Aplastic anemia due to destruction of red bone marrow or caused by toxins or gamma radiations. Normochromic, normocytic anemia, there is normal MCHC, normal MCV levels. These includes anemia of chronic disease, hemolytic anemias, those characterized by accelerating destruction of RBCs, anemia of acute hemorrhage, aplastic anemias, those characterized by disappearance of RBC precursors from bone marrow. Hypochromic microcytic anemia, in these low MCHC and low MCV levels. These include iron deficiency anemia, thalassemia, anemia of chronic disease. Normochromic macrocytic anemia in this normal MCHC, high MCV. These includes vitamin B12 deficiency and folate deficiency. These are some signs and symptoms. The common symptoms of anemia includes easy fatigue and loss of energy, usually rapid heartbeat, particularly with exercise, shortening of breath and headache, particularly with exercise, difficulty, concentration, dizziness, pale skin, lack crumbs, insomnia. Anemia caused by iron deficiency. The people with an iron deficiency may experience hunger of strange substances such as paper, ice, or dirt, upward convulsions of nail, reference colonakia, soreness of mouth with cracks at the corner. Anemia caused by B12 deficiency, the symptoms are tingling, pins and needle sensation in the hands or feet, lost sense of touch, a bobby gait and difficulty walking, clumsiness and stiffness of the arms and legs, dementia, hallucination, or schizophrenia. Some more signs and symptoms: brittle nail, colonakia or spoon-shaped nails, atrophy of papillae of the tongue, angular stomatitis, brittle hair, glossitis, plumber vision. These are some signs and symptoms. Thank you. This session powered by Digital Version 2.0 JVW University. Hope you are satisfied with digital session. If you have any query, please mention in the comment box.